Good afternoon, everybody. Thank you so much for joining me again and welcoming me back to the PS 138 community. My name is Dr. Erica Rooney. I'm a clinical psychologist with the Child Mind Institute on their Student Success Program. I do specialize in our trauma service, but I do provide treatment and services to on several other services as well. A couple of just housekeeping points before we get started. I would love to be able to answer any of your questions throughout the presentation. So if you want to, you can jump right in and just ask me. Otherwise, we can certainly reserve time towards the end. I believe we'll go to about 3:15 today. So I'll do my best to stay on target. And if Ms. Minguia or anyone could just, give me the heads up if I'm getting close to the time, that would be great. Another item, go ahead.
No, I will tell you.
Okay, perfect. And I did share a handout with Ms. Minguia, and I shared it late, so I apologize, but she sent it out. So I just want to orient you to your emails. It's okay if you don't have the sheet or if you're unable to print it out, but just to have something if you wanted to participate in a very brief interactive activity in a few moments. Okay, so that being said, we'll get started. Today's topic is when to worry about your child's worries. So really very much about understanding anxiety and how to help as parents. Just some basic information about the Child Mind Institute. If you're not familiar with us already, we're a national nonprofit organization dedicated to supporting children with mental health and learning disorders. So to give you an overview, we'll talk about sort of the general fundamentals of anxiety, what it is, how it functions as our internal alarm system. I'll also kind of walk you through sort of what's more typical of anxiety and fears and worries across development and the different stages of childhood, as well as sort of distinguishing between what's typical and what's atypical, or what's, where it becomes clinically important to perhaps address through clinical intervention. When it becomes a disorder, I'll run through very briefly, depending on the time, the different types of anxiety disorders, some of the contributing factors, and how to best support an anxious child, different contributing factors, as well as tips and recommendations, and then we'll have some time for questions and answers. All right. So let's get started. What is anxiety? I think we all kind of use this term almost on a regular basis, particularly now during these really uncertain times with so many different current and social events and a pandemic that we're all grappling with and really exacerbate anxiety. But anxiety and fear really go hand in hand. They are part and parcel BFFs. They really work hand in hand. So it's important to really separate out those two entities, those two emotions. Anxiety can really be better described as comprised of an expectation or a worry that something bad will happen in the future. It's a very future-oriented entity. So things for children, they may be really worried about something coming up. Am I going to get a bad grade on a test? Am I going to get sick? Is something bad going to happen to my mom or my dad? Are people going to make fun of me, right? It's very much about the worries about the future. Fear can happen, it's more of an immediate reaction, right? It's an immediate reaction to something actual or perceived threat of danger or harm, more so in the moment. Now, we can fear things coming up in the future, but fear at its core is something that's a little bit more immediate to a real or actual threat to harm. So as simple as a child being afraid of seeing a bee and therefore they might worry they might get stung. That's more of like in a simplistic form, worrying about a dog biting them. That's something that might be happening right in front of them, and therefore they're very concerned in that moment. They get very afraid. Anxiety is a little bit more in terms of the thoughts that are surrounding the future event. But both of these are comprised of both cognitive or thinking components, as well as emotional, behavioral, and physiological components. Okay. So At its core, our anxiety and fear is triggered by our internal alarm system. This has been hardwired in our brains from the beginning of time for humans to help us survive, right? It's for survival purposes. And anxiety and fear alarm us to something is dangerous, to protect us and keep us safe. And so we experience it, as I said, in so many different ways, emotionally, cognitively, behaviorally. This really highlights, this image here really highlights where in fact it starts to play out. And it's really important to get an overall sense of where we experience it physiologically, because so much of that happens sometimes even before we're thinking about our worries, right? This can happen and get triggered by an event that can start to make these happen inside of us before we start to think and realize that we are feeling worried. So for example, our eyes, pupils dilate, right? They get really wide because we are seeking out a way to escape this threat that we are experiencing, right? Our lungs we start to breathe faster, our heartbeat increases, we start to really take in a lot more oxygen to prepare ourselves for the fight or flight response. That's another word for this alarm system, right? So our blood vessels, our blood pressure increases, our blood vessels dilate. It's really preparing us to bring blood to our muscles to escape or to fight. So our muscles become more tense. Frequently, as many people experience, as many children experience, they get a lot of stomach aches because it's very connected to our emotional response and our parasympathetic response. So this is, there's enzymes that are sent out so that our stomach can get rid of what no longer needs to be digested, so that it can focus on staying alive and surviving and protecting ourselves. So the blood is going in a different area of the body. Our skin starts to sweat, or we might get chills. So it's a multi-system experience that we feel in so many different areas of our body. So here, just get started really quickly. Here's like a little bit of an interactive activity I thought I would just challenge you a bit to really think about before we get into our children's worries and anxieties. I think it's really important to think about, how do we as adults experience anxiety, right? How do we experience that fight or flight response, right? So if you were able to get the handout and see the body diagram, I think it could be helpful to, let's see here, I'm going to try to do it on the screen with myself. But let's think about that. Like, so I'll give an example of a situation that many people feel worried about. It may not worry you. So if you have another experience or idea of like what might bring out your worries, feel free to use that example. But I'd like for you to really zero in and think about how your body responds for this particular prompt, which is that, say, for instance, you are tasked at your job or at school, being a part of a parent group, that you have to speak to a large group of people, let's say maybe 50 to 100 people, and it's not something that you really feel comfortable doing. So I'd like for you to be thinking about what is going on in your body as you start to, as you get closer to that event. Say you're walking up to the school, you're walking in. I know for me, my heart rate starts to beat really, really fast. Anyone else? So as you're thinking about, go ahead, I'm sorry.
I feel it in my stomach.
You feel it in your stomach. Great. It's a common place to feel that. Can you describe a little bit what you might feel?
I feel my stomach tight.
Feels tight.
Like like a sensation that is my muscles is tight. It's very tense.
Yes. Yes. So your muscles are tensing up, particularly your stomach's probably cramping, right? Because it's shifting from a function of digestion to quickly shifting over to changing over. So it's no longer doing that. And so it has to go through these different, this different process. It's a great example, and frequently why we get lots of stomach aches. So your stomach muscles cramp up, your heart beats fast. Anybody experience getting sweaty, perspiration, anything like that? I would just draw it in on your picture. I also get, I'm going to put it here. This is not the best way of doing it, but I'm trying. I get really hot, right? When you're nervous, you start to get hot. Your heart rate is like spinning, right? Your might be shaking is another way. I can't do it here too, but you can draw on here as well, right? Your hands start to shake. Your foot might start tapping. Another aspect, it's going to be difficult for me to draw on here, but please include it on your drawing if you are able to, is that our eyes get really wide. As I mentioned before, they start to dilate, and we're starting to seek and track around the room to see, we're just looking for a way to escape, right? And that can frequently happen. So eyes can be really big and wide. Anyone else want to share some others that they might experience?
Can you please explain what is the fight, flight, and freeze response?
The fight or flight response? Sure. So I'll just go back to this slide here. Can you hear me okay? Hello?
Yes, we can hear you.
Okay, great. Thank you.
Now I hear you.
So the fight or flight response is just another term for our stress response system, which is what I have up here on the screen now. It's what we call it, like our internal alarm system to alert us of danger or harm, right? So this whole system here, what is going on here, it's actually triggered by our parasympathetic nervous system, but these are all the different responses that occur in order for us to either flee the situation that could be dangerous, right? So flight, get away from there. Avoid, I'll get into that word very much later on. We might want to get away from that situation, or we might want to fight. It might activate us, right, to try to ward off something dangerous that could be potentially threatening to us, right? This has been hardwired in our brains from the beginning of time. So for cave people, this was something that helped them ward off from the attack of animals or other human beings, right? But in essence, it's really meant to keep us safe and protect us from anything dangerous. So all of these, our body mobilizes through the range of responses that you see here on the screen as a way to help us be effective in that fight or flight, right? So that's what these functions are. Our eyes open up really wide so that we can look around and survey where we need to go quickly. Our bowels our digestion system shuts down so that the blood can go to our muscles and our breathing so that we can breathe heavier and move faster, right? Our skin, actually sweating, there's some people suspect that we sweat not only to cool our bodies down, but also to prevent another, animal or individual from grabbing onto us. As well as, as I said, the heart rate increases, our saliva flow decreases, right? Our digestion starts to slow down. This is all happens in a split second when we feel something is dangerous or scary or harmful, but it's meant to protect us. Make sense? Does that seem clearer now? Okay. I brought this illustration. If you can't complete it now, that's totally okay. I just wanted to get a sense of helping you sort of tune into how you experience something worrisome or anxiety provoking that might not be something as extreme as like a threat on your life, right? We can still, that system still gets activated, even though we're in, current contemporary times, and something feels maybe, threatening to us. It's just a different type of threat, right? We show anxiety on the outside by the different behavioral responses that I was speaking about, right? But we might tap our foot, our hands shake, we might pace around a room, right? We also might get irritable or we might get moody. That could also shift. And so that then it starts to exhibit, and that's what we communicate to other people. So for children, they experience that exact same response when something is fearful or something that they're worrying about, right? So it's important to start to distinguish between what might be sort of typical fears that we see in childhood that would be, may cause worry, right? But it may also be something that's typical based on their developmental level and stage that they're in. So with infancy, as you may know, right, or as you've noticed in your own children, right, we start to see this in their responses to sudden loud noises, right? They might, jerk really quickly. They have a stronger startle response. Maybe as they start to, grow a little bit older in infancy, they start to, recognize between who their caregivers are versus who is a stranger. So they start to notice that, and they may respond to that with fear. In early childhood, separation is still a primary fear that children experience, right? Separating from caregivers or close family members. It starts to take on more, the more their cognitive abilities develop, right? It starts to sort of match their developmental levels. So they start to fear things like the dark, monsters, imaginary creatures, and starting to have anticipatory anxiety. That's the anxiety of thinking ahead to the future, but it's a little bit more, simplistic at that level. These are all still typical, and they tend to, sort of reduce over time. And again, here in middle childhood, it's starting to shift and become a little bit more sophisticated. So they might have more fears about real world challenges, things happening in school with peers, right? Taking on new tasks, joining a new club or playing a new sport. Those kinds of things can start to really trigger some of their worries and fears, right? School becomes a much bigger component to their concerns and their worries. And as they move into adolescence, of course, we know their peers and their friendships are most important. So social status is really critical and can play an important role in their level of anxiety, performance in school, performance in athletics, or any kind of performing arts, right? And because of their ability for abstract thinking, they can really start to fear, right? That's like worrying about whether or not you're going to worry or be afraid in another situation. Right, so you can see here that while these are very typical and normal, they do occur sort of in short episodes over time when it's more of a typical a typical fear that's part of more of their developmental stage. So what can make kids more anxious than others, right? We have some kids that we call like the dandelion kid. They can just be put in any situation at any time. They don't require a lot of grooming or care, right? And they can really flourish in any type of environment. And then we have some kids who are anxious because of temperament, because of family history of anxiety, perhaps just the biological predisposition to experiencing more anxiety or have more of a slant towards feeling more worried and fearful, right? And that can be that becomes a combined factor with nurturing, right? Sort of the behavioral experiences and observations that that may contribute to their environment, whether it's school context, home context, whatever it may be. All of these factors come together that can create higher anxiety levels for some children. And anxiety can present itself in so many different ways, as I was saying, right? Depending on age level, developmental level, but I'm sure as parents, you have all seen at least one of these occur in one of your children when they are feeling worried, right? They might start to overplan. If they're a little bit older, they might try to overplan and ask lots of questions and make sure everything's in place. Perhaps if they're younger or even older, right, they might cry, tantrum. They have difficulty managing their emotions. They get a lot of the somatic complaints, right? Stomach aches, headaches. They might avoid activities or events. But all of these can manifest, as I said, in different ways and at different age levels. So this is when it becomes more of a problem, right? We can have these common fears where a child is afraid to go to bed. They want to make sure they're doing some checking behaviors to look underneath their bed. They might be worried about that. But over time, that starts to go away. Characteristics of problem anxiety, when it starts to become more problematic, not necessarily at the disorder level, but it's starting to grow into something that's a little bit more unrealistic, that the response to something that makes them feel very anxious and worried might be out of proportion to what is actually happening. It could be something more neutral, but their response is an explosive tantrum, or they're running away from something that could be what seems to most people as more like neutral or benign. It's uncontrollable. It can be unwanted. They don't want it at all, but it's happening anyway. They can't control it, and it doesn't go away, right? So all of these factors, as the anxiety begins to grow and become more of a consistent pattern, children start to learn that by avoiding something that makes them feel nervous and worried can help them feel better. But that only happens in the short term. In general, because anxiety is such a, even though it's comprised of our biological or physiological and our behavioral responses, so much of it is based on our thinking. And so we really think of anxiety and anxiety disorders as a fundamental thinking error. And as sort of a way or conceptual framework to think about it is that children might really overestimate how badly a situation will go, right? If they have something coming up, they're overestimating how badly it's going to be, how likely a bad situation is going to happen, right? That it's definitely going to happen, but they underestimate their ability to effectively cope with that situation. So they're worried and they're fearful that they won't be able to get through it. So when does these, what we call typical anxieties and worries, right, that are fairly common, when does that become a disorder? Okay, so we want to think about 3 different areas. The first is frequency, right? If we're thinking about anxiety as being a disorder, we want to be looking at how often is this happening to this child, right? How often am I seeing some of these symptoms? How often are they showing themselves? Is it just once every few months? Is it a couple times a week? Is it a few times a day, right? Those are all sort of telling, we want to think of it as on a continuum, but the more frequent we're seeing these symptoms, certainly the closer we're getting to something becoming more impairing, right? Duration is really important too. How long do the symptoms last, right? Is it fleeting and does it last very long and they can move on quickly to the next task at hand? Or is it really chronic, longer lasting, harder to reset? That can be problematic too. And while all 3 of these are important in terms of starting to think about when should I be concerned about my child's worry and anxiety is to perhaps receive intervention, is when it becomes impairing. And not just impairing to the child, which is, certainly primary, how it might interfere in their daily functioning. Can they go to school? Can they perform at the same level in school? Are they able to make friends still or not? Are they able to sustain those relationships? That's really important to see. How is this worry impacting their lives across the board? This is their daily job. Getting up, going to school, and building in social relationships is their primary tasks in childhood. If their anxiety is interfering here, this is where we want to start to strongly consider getting clinical intervention. But the other part that I want to make sure to note is that sometimes the impairment may seem like it's not impairing the child as much as it might be impairing the family structure, the family system, family functioning on a daily basis, right? If a child is, fearful of going to school and refuses to go to school, it may be distressing to them in the morning when they're sort of fighting to not go, but they're comforted in staying home, whereas this can cause a lot more problems and a ripple effect within the family and for parents. And we'll talk more about how this becomes a more reinforcing factor. I'll stop here just for a second if anyone has any questions they want to ask or thoughts, concerns, anything.
I have a question.
Sure.
Okay, so I have children that are in kindergarten, and I have a son that is 6 months. And I had anxiety during pregnancy for the infant, and he has separation anxiety. Would that be a connection, or would it be like just him being attached?
So the 6-month-old has he
has separation anxiety. Like whenever I was with somebody to go, say, to the store, to go to the pharmacy, or something where it's like a quick little errand, like, he'll have a big panic attack almost. Like it'll look like he's like freaking out, like somebody hurt him, somebody hit him, and nobody did anything.
Okay. And how long?
I was very.
Go ahead. I'm sorry. Go ahead.
So during pregnancy, I was very anxious, but with the twins, who are the ones in the school, I wasn't, and they don't have it. So would it be connected to that?
That's a good question. It's possible. I mean, without knowing, your child or your family or anything like that, it's hard to know that it is a possibility, because stress can affect sort of things that may be going on developmentally in the womb. It may be that may be just also part of his temperament relative to his siblings, right? We can have children who are, related, their siblings, and some may react, very typically speaking, so to speak, to separating. Let's say you didn't have anxiety, while you were pregnant. You might still see that happen with your child. So it's hard to know, but there are some connections to show that their stress can sort of affect how temperament plays out, but it's not the whole picture. If that
okay, I seen you said genetics somewhere in it earlier that could be passed down genetically, like say if a parent has it and you have it. I thought that would be connected to that.
You were right. You're absolutely right. But just being stressed alone during the pregnancy wouldn't, in and of itself, do it. It could be that a parent may have higher levels of anxiety sort of across the board, and perhaps given the current factors of something going on, it may be expressed more. I don't want to go ahead and say, like, you may have had anxiety during that moment. I don't know you enough to say it was, you have more of a temperament toward anxiety. But there is a biological component to anxiety. I don't know enough to say that that's sort of
I've been diagnosed with anxiety.
Oh, okay.
Before,
okay. Well,
I had this anxiety disorder with, like, earlier before I had the children.
Then yes.
In the school, I had the anxiety disorder, but it was more calmed down. Like, it wasn't as bad. The child that I have now, which is 6 months, I had it very bad. I had it throughout before that.
Okay.
So
thank you for sharing that. I was unaware. I mean, yes, if there is a history of an anxiety disorder in the family, whether it's from you or an extended family member, that definitely increases the likelihood of a child developing anxiety. There's a number of factors that can contribute it, but that is a big component, a biological history of it, not just contextual stress or anxiety, if you know what I mean.
Yeah, I get it.
Okay, perfect. Okay, thank you. It's a great question. Anyone else? Okay. So here we're just listing some of the different types of anxiety disorders that are current from the current diagnostic manual. There's, separation anxiety disorder, as we were just speaking about. There's generalized anxiety disorder, social anxiety disorder, obsessive compulsive disorder, which actually has its own category in the diagnostic manual, but it still functions as like a two-part anxiety disorder. Selective mutism, which is new to the anxiety disorders, not new in terms of presentation, but new in terms of classification, but where a child is really unable to speak in a social setting, but is highly verbal and expressive when they're at home. Panic disorder and specific phobias. I will get into more details of each of these, but just in the interest of time, I also want to be sure that I cover some of the other parts of this, and I can see that we're at 5 after 3. So separation anxiety, as you may understand it to be, it's really an intense anxiety about being separated from one's caregivers. There's persistent worry. It typically can develop before the age of 10, but it can certainly last or develop afterwards. We even know now that some adults can develop separation anxiety with close others as well. But we see this play out in lots of different ways. We may see social withdrawal and avoiding going to certain situations because they want to remain at home with their caregivers. There's like the somatic complaints of headaches, stomach aches, and refusal to go to school, camp, different social activities that would be, typically something that your child would want to go to. You're going to see excessive reassurance seeking show up in lots of these different disorders. And that is where a child really requires a tremendous amount of reassurance to help them feel like they will be okay, or the parent or caregiver will be okay. So they may ask repetitive questions, knowing the answer already, but still asking it they're not just collecting information. They are really looking to be comforted and told that things will be okay. You'll see this in a lot of the disorders. Generalized anxiety disorder is the kid that just is worried about so many different things all at once. They may be worrying about their school performance. They might be worried about the Middle East and the problems going there. They might be worried about whether or not their parents are okay, whether or not someone is sick. Should we shut all the electricity off or not before we leave the house? But really intense worry about a number of different things. They are definitely the kids who think about the worst case scenario. They're always expecting the worst. You will always hear with children who may have generalized anxiety disorder a lot of what if questions, right? What if the lights go out? What if someone isn't home? What if I lose the keys? What if I get to school and I fail my test? You know, it's the kids who are constantly thinking ahead and worrying about a number of different areas of their life. We see it frequently with kids who have a perfectionistic tendency as well, but that isn't just the only factor. But they will also experience lots of somatic symptoms as well. Social anxiety disorder. This is where children have an intense fear of social evaluation. And this can occur in very specific circumstances, say only in the classroom, or it can occur as more of like a generalized social anxiety with just meeting new people, going out to new situations. But they're really afraid of doing something embarrassing, about being negatively judged or evaluated. We do see this a little bit more commonly in boys, but it certainly is prevalent for both girls and boys. And typically you would see their response to it is more disproportionate to what the social situation might seem to most people. It can even look like excessive shyness. But this is where there's a lot of avoidance around engaging in any kind of social situation, especially where they have to speak or perform in some way where they feel they might be judged. Selective mutism, as I mentioned, this is a fear of speaking in certain situations, not all. So they can be highly verbal, talkative, all the time at home, but the minute they step out the door and they go into a store, someone asks them how old they are, they shut down, they're frozen. This might even happen in school, to the extent where children might refuse school. They might even refuse to speak to the teacher, advocate for themselves, raise their hand to go to the bathroom. They're fearful of speaking at all, and it can really impair their ability to really function. So this is, it can be quite impairing, but we see this mostly sort of develop around the age of 5, but it can certainly continue on beyond that. And a specific phobia, this is where someone has just a really significant severe fear to something very specific. Some of the common ones that you see here are the dark, strangers, particular type of animal, getting a shot or a needle. And again, this is, it's an unrealistic excessive fear, but it's prevalent in about 5% of the children and 16% in adolescents. You'll see a lot of avoidance with a specific phobia too, particularly as it relates to the object or the item that they have their phobia of. They are typically do not understand that the fear might be irrational. You know, a child might have an excessive fear towards tarantulas. And even though they've never come across one, will never probably see one, they may have a significant fear of that animal and avoid anything that might even include a picture of one or such. So it can really be extreme. And panic disorder. This was just mentioned a little bit ago, but certainly this is a misinterpretation of an event or a fear of an upcoming event, where this is where we see the fear of fear, where we're worried or fearful that something might happen and escape is not available for you, or that help will not be available to you. And you may, you start to feel a lot of physiological symptoms that can really feel like someone is having a heart attack. It's all the symptoms that we saw originally in that fight or flight response image that I showed earlier, where you get increased heart rate, sweating, trembling, and it comes without even realizing it. It happens very quickly. So you can really think that could be something medically wrong with you. For children, this we see showing up as like lots of frequent trips to the nurse's office, right? They have a lot of stomach aches, headaches. They're not sure what happens. They just freeze and they feel like they're going crazy and they don't understand. They might cry a lot when it happens to them, but it can be greatly impairing. So the role of avoidance is really critical in a child's anxiety and how it can maintain the anxiety, especially maintain it at a level that's highly intense and impairing. This is when the child does what seems natural, which is to avoid the thing that they fear or worry the most. But what that does is keep them stuck in that high intensity of that object. They don't learn by avoiding this, feared experience or object. They don't learn that they're able to cope through it. So they continue to avoid it, and it maintains their level of high anxiety. All parents are well-intended and really want to be able to contribute to, help their child along and support them. And also, as parents, we need to get through our day, right? And get through our tasks and make sure that everybody's functioning and moving through the day so that you can just get through it. So sometimes parents may inadvertently play a role in their child's anxiety by contributing to that avoidance, right? Because sometimes if a kid is refusing to go to school or refusing to go to an event, it's sometimes in the short term easier to just say, okay, forget it, we're not going to go today, right? Or they're having a meltdown or a panic attack in a store and they want to leave. It's just easier to do that because it's so stressful in those moments. But we can participate in the child's anxiety behaviors, right? We might even provide reassurance to help answer their questions, right? We want our child to feel better. We want to comfort them. But sometimes what this can do is really sort of exacerbate the symptoms, right? We might do more things for our children, take on extra responsibilities in order to accommodate that anxiety, just so they don't get upset. But actually what we're doing is intensifying the anxiety. So some of the suggestions you will see will be around helping to sort of, once we can identify the degree of anxiety that a child may be experiencing, then we want to be able to find a way to balance out to help them learn how to cope slowly and gradually on their own and face some of these fears. This is an image, we call it the worry hill, especially when we're working with children, but it shows this graph of how avoidance works, essentially, right? If we think of it as climbing up a hill, right? The intensity of the anxiety, it's slowly and gradually building, right? Let's say they are walking into a classroom they're about to take a test. So right before they even get to school that morning, they're thinking that way. Maybe they're at a low level. It keeps increasing as they get to school. They get to the classroom. They get to the top of the peak. They're at the highest peak of the anxiety, and boom, they're like, I can't do it. And they run out of the classroom, right? They're avoiding the intensity of that fear and that worry, which then they escape it by running away. But in fact, what that does is maintain it at that very high level, right? They don't allow themselves to learn how to cope through that and ride that wave of intensity. So it maintains it at a very high level. Here, for example, it's the same idea. This is what we call negative reinforcement of that cycle of anxiety. It's just breaking down the previous slide a little bit further. I'll explain it using a case of like a child with selective mutism, right? So if we start at where the child faces anxiety-provoking situation, let's say they are at a restaurant with a parent, they're talking, they're laughing, all of a sudden the waitress comes over and says, it's so nice to meet you, how old are you? And the child freezes, right? And the mother feels a little uncomfortable. The waitress might feel a little uncomfortable. The child looks like he's ready to, he just, saw like the scariest thing they've ever seen. And so then the mother gets really anxious. Then the child puts the head down, doesn't say anything. The adult comes in and rescues them and says, oh, I'm sorry, she doesn't like to talk. She's really, she's shy. Right. And so in the short term, the child and the adult's anxiety are lowered, but in the long term, it's reinforced it. And we think of negative reinforcement as when we take away something, that behavior then increases. Okay, so here we're taking away the anxiety and through avoidance, and it increases the avoidant behavior. So just to move on to get a glimpse of what reassurance seeking is like, as I'm sure you may have all experienced this with your children from time to time, but for children with anxiety, you probably see this very frequently, and it can be really trying and stressful over time. But it's a form of accommodation, right? The child is seeking out comfort for a feared outcome that they aren't even sure will occur, but because they're worrying about it, they think it will. It's a short-term relief from anxiety by asking repeated questions that they already know the answer to. So again, it's another form of negative reinforcement. Questions like, and some of these examples are based on the different disorders that I highlighted. But am I going to get sick from eating this? That can be a function of like a phobia. Are you sure that the front door is locked? Can you check? So repetitive checking behaviors. Did you wash your hands after you use the bathroom? With separation anxiety, lots of parents and caregivers experience this one where a child is calling them repeatedly, multiple times, whether they're at work or they're out with friends or whatever they may be doing, the child just continually keeps calling to make sure they're okay. They might ask really benign questions or things that they already know the answer to, but they just need to know and they need to keep calling and making sure they're okay. So here I list some ways that what you can do instead to start to help reduce reassurance seeking, which is helping them to practice being uncertain, right? Helping them to realize, like, I don't know all the answers all the time. We can't know the outcomes of everything all the time. So helping them to slowly and gradually live with uncertainty is a way to do that. Modeling good coping behaviors, really encouraging and praising them for when they do show signs of facing their fears, like taking brave steps, taking risks. All of those should get lots of labeled praise. So let's say you get into, as many may have, a battle because of avoidance with your child, right? This is like those moments of intensity where child's refusing to do something, go somewhere, whatever it may be, but it starts to escalate. So the best way to effectively work through this, and this is hard, I'm not suggesting that this is easy to do, but the minute you can realize that avoidance is what is at play, try to disengage and ignore the demand or the avoidance at the earliest that you can recognize it. So what do I mean by that? Try to de-escalate the situation, because if you stay at an escalated level, it's just going to intensify everybody's emotions and nothing will be able to be solved in that moment. So because of the intense worry and anxiety that is going on, it's best that you model and be the calm in this storm for them, right? So just engaging back, sort of stepping down and allowing them to sort of just shut down and help them sort of manage through this, but don't engage in argument back and forth. Having a more neutral reaction, even if it means pausing, taking some deep breaths for yourself, trying to sort of work through it for your own self-care, and avoid punishing in that moment, because we want to help the child correct the behavior through effective coping. And punishment in that moment can send an inaccurate message for that moment. It's not to be punished, it's meant to be corrected. So we want to help with slowly helping them face their fears. So just some general parenting rules for anxious children, some basic do's and don'ts, making sure that we maintain positive and realistic expectations. We always want to encourage our children to reach and be the best that they can be, but managing that with some balanced perspective is helpful, so that they know what your expectations are. Respecting and validating your child's feelings, encouraging your child to tolerate their anxiety. Think things through with your child, like kind of examine it together as scientists and really think through what the content of those worry thoughts might be, so that you can help sort of manage them and correct them in the moment. But what can be really difficult and really maintain anxiety and make it persist longer than we ever want for them is by, we don't want to give excessive reassurance, right? We want to be able to catch that and shut that down. We want to be able to don't ask leading questions that can help like fuel the anxiety, right? We don't want to reinforce their fears. And we certainly don't want to help them avoid something just because it makes them nervous. It's okay to be nervous and find ways to get through it so they can get through the task at hand. These are just some triggering events that can make children and adults really more vulnerable to intense anxiety, right? So if a if an anxious child is tired, hasn't really eaten, hasn't really had medications or whatever medications they're taking, it may not even be psychiatric, but just in general, if their equilibrium is off, that's going to sort of intensify their, or make it even harder for them to manage their anxiety, right? Unexpected changes in schedules. These are the environmental factors that can also affect anxiety and intensify it. Long car rides without any real information, noisy, crowded areas. It's always helpful to just prompt children, give them the information that is developmentally appropriate, but enough for them to understand what they're, where they're going, what they're doing, but so that the uncertainty isn't at such a, a high level. But these are some things that can affect and increase one's anxiety, and especially if they have mood-related difficulties in the moment associated with something different other than their anxiety, that can also make things worse. Some coping skills to practice on your own as well as with your child. Distraction in the moment can be helpful, especially in that like avoidance battle moment, just to kind of move them away to something a little bit more positive, redirect them to help shift their thinking a bit. It can be confusing because we talk about not avoiding, but in that moment, we want to help them, sort of guide them towards something a little bit different, just to sort of bring down the temperature of their anxiety. Using positive self-talk. This is hard. I've done this before, though. I'm going to get through it. This is really hard. You're doing a great job. Bossing back the anxiety. We do this with children in therapy, where we help guide them to thinking of the anxiety as ability in their brain and sort of bossing it back to them and sort of self-talk back to the anxiety. Using guided imagery, taking a mini mental vacation. Basic relaxation techniques can be helpful, with even just on a regular basis, to kind of help, sort of orient the child and help them feel sort of grounded in their everyday life. But then also when these events occur, they'll know how to use these skills on the fly, and they'll be better able to put them into effect. And coping ahead. So if, for example, you have a child who will become very anxious with an event coming up, whether it's a new basketball game or a test coming up in a few days, come up with a coping plan together that like breaking it down step by step and helping that child plan ahead and know what they can do to help themselves feel better before it, during it, and even after it, right? So that's helping them sort of anticipate what might get them really worked up and anxious, but also knowing that they will have skills in place that they can help sort of manage this more effectively. And of course, always managing effective coping as a parent to the best of your ability. Just treatment for anxiety disorders, really the best practices for children is evidence-based treatment. Cognitive behavioral therapy is one of them, where we target the three primary components of anxiety, which here is, you'll see here, where we target the thoughts, feelings, and behaviors that are all interconnected and can manifest and develop into an anxiety disorder over time, if not intervened with. Okay. So just in summary, helping anxious children starts with really educating yourself and your children about what to look for, what to be thinking about, what you're experiencing in your own bodies. Creating an environment that has open communication and sharing and validating of experiences and feelings. Having an openness and willingness to consider alternative treatment services and supporting your child in that way. Collaborating with your school staff and your team for your child at school is really another helpful way to make sure everyone's on the same page and you're all sort of working together in tandem to support your child. Not jumping the gun and trying to solve problems too quickly, but just really listening and providing that open communication. And as I keep saying too as well, modeling non-anxious coping, even if we are anxious, right? To the best of our ability to model calm and even coping, right? You can even show some distress, but working together as, using some coping skills together is the best way to show how to help your child through their worries. Yes.
We are all done?
Yep.
We are all, okay, because we are almost wasting the time.
Okay. Okay, great. So I'm certainly happy to answer any other questions anyone may have.
parents, this is the time. You can ask any questions.
I have another question.
Sure.
Okay, so my children are 5. What are good ways I can show them how to cope with anxiety without it being too complex for them?
Sure. So one of the best ways to do this is something I think they can do it on the fly anywhere. It doesn't require any tools or anything, is like deep belly breathing. Right. So just do it. And I can even send you some ways in which you can do that with 5-year-olds, because sometimes it can be, we don't want to get too complicated with it, but just showing them that once they start to get worked up and anxious, or they're starting to get, sort of antsy in their seat, best way is to kind of say, okay, remember, we're going to do our deep belly breaths, right? And you can even make it sort of a fun task of just first showing them, and then they can hopefully eventually do it on their own, but sort of just slowing down and taking very slow, deep breaths through their nose, and telling them to push out their belly when they take a deep breath in, and slowly blowing out through your nose. You can tell them to do it 5 times. You can practice it together. If you need to go beyond 5 times, that's fine. But that is a great relaxation technique in the moment that can be used anywhere, and kids of all ages can do it, and they can practice it, and they can sometimes even, I've had lots of kids I've even showed that to, who like teach their other brothers and sisters about it, right? Another.
Please send it to me.
Say that again?
I said, I would love that. Please send it to me.
Absolutely. I can send it to you. Another way is, sometimes this is good for muscle tension, but it could really be to also help kids fall asleep if they're having trouble falling asleep, it's really called progressive muscle relaxation, and perhaps you're familiar with that in that term. But for kids, you can call it like robot ragdoll, right? Where you tense up all of your muscles really tight for like 5 seconds, right? Like a robot, right? And then you release ragdoll. And you could do that repeatedly. So especially if they're laying down in bed, tensing up your muscles for a short period of time and then releasing them, it draws the blood in, it helps to sort of relax the muscles, and then there's a calming effect afterwards. But children really like that analogy of like robot ragdoll. We sometimes call it squeeze and release, or like squeezing lemons really tight. But the idea being that you want to like gradually and consistently like tense up all of your muscle groups. So that can be done almost anywhere, I think. But I'm happy to send other relaxation techniques. Another one is like taking a mini mental vacation in your mind to your favorite place. It doesn't even have to be like a vacation place. It could be like their favorite room, their favorite, restaurant, their favorite activity, but to really sort of take in and focus in on their 5 senses of like what they would be experiencing when they're at their favorite place. What are the foods you'd be thinking about or eating, right? What would that taste like? What would we be smelling? I had a student, a few months ago say like, Coney Island, and I was like, great. What would you see there? What would you be smelling? What would you be like hearing? Right. So all of those things, are fun family activity, I think, but also little kids can grab onto them. But I'll send you other resources, and I'm happy to send them to everybody too. I'll send them to Ms. Minguia so she can pass those around.
Thank you very much, Ms. Rooney. Thank you very much, parents, for coming, for staying connected with us. Any questions or any material, you can contact me. I wrote my email and my phone number on the chat, so you can copy before you leave, and we get in touch. So,
absolutely. Yep. And any questions that you might have that come up afterwards, feel free to ask them, and they can be passed along to me. I'm happy to help in any way. Okay, thank you again. I know you're almost at the finish line for the end of the year, so great work this year managing some really tough times. So give yourselves a hand.
Thank you so much for helping us.
You're very welcome. Okay, be well. Bye-bye.
Thank you.
You're welcome.